everybody. This is Mohamed Abdel-Kader. I'm the Deputy Assistant Secretary here in the Office of Post-Secondary Education. I work with the International and Foreign Language Education team. We oversee the Title VI programs and the Fulbright-Hays portfolio here at the department. My team primarily focuses on world area studies and less common taught languages. We have a lot of our grantee institutions on the webinar today, so hello to everybody who's there, and hello to all of our other guests who have joined us. We're really sponsoring this webinar today with our friends from the Department of Health and Human Services and the Centers for Disease Control and Prevention in Atlanta. We know that coming summer, all students and faculty members will be heading overseas for hopefully some fantastic experiences abroad. We want to continue to make sure that those folks are safe and have the most up-to-date information as concerns pop up. Obviously, if you've been watching the press, you have seen obviously some concern about the Zika virus. We wanted to connect with our colleagues and make sure that we brought in some expertise to tell us what we know and what we should be worried about. Emerge here in the United States and the continental U.S. For those of you who are university administrators, we want to make sure that you've also got the up-to-date information to know how to deal with it if it pops up around your campus. So a couple of housekeeping notes real quick, and we'll go ahead and get started. If you have questions, you can type your questions directly into the chat box that you can see on your web screen. We are also taking questions on our Twitter feed, on the Twitter feed. That's @GoGlobalEd if you're on Twitter. We will be addressing questions after the main part of the presentation. I want to, in advance, say thank you to Dr. Kachur with the CDC, who is our presenter today. And I will be turning it over momentarily to my colleague from HHS. But I just make note for housekeeping purposes that this call is not for press purposes. If you are press, please contact the Public Affairs Department at HHS for further details. So to my right is Karolina, Wasiniewska from HHS, and I'll be turning over to her to take it away.
Yep, thank you, Mohamed. Good afternoon, everyone. My name is Karolina Wasiniewska, and I'm with the Office of Intergovernmental and External Affairs at the Department of Health and Human Services. We are very glad that you've joined us today for the webinar, and thank you so much to the Department of Education for partnering with us on this important topic and to help us get the word. I am now going to turn it over to Dr. Patrick Kachur, the Acting Principal Deputy Director at the Center for Global Health at the U.S. Centers for Disease Control and Prevention in Atlanta, and he will talk about what we know and what you should know about Zika. Kachur.
Mohamed. I'm going to talk to you today as the Acting Principal Deputy Director at the Center for Global Health here at CDC. The response that we as an agency are undertaking on the part of CDC and as a partner among the whole of the U.S. government really spans across all areas of our organization. Virus. It was recognized first in 1947 in a monkey in the Zika forest in Uganda. That it was identified in mosquitoes that were proven to be the carrier of the and the first infection in a human being was detected in 1968 in Nigeria. For the 50 or 60 years, very few cases of Zika virus infection or illness in people had been documented, and the mission pattern was described as sporadic or endemic, very level, and few cases. Since the 20th century, we've seen a couple of very different situations where the virus is newly introduced into new countries and new territories, where the mosquitoes that can carry it are already present, and it results in explosive transmission and large-scale outbreaks. The first was in the Western Pacific in 2007 and in 2009, and a more serious issue we're dealing with now began late 2014 2014 or early 2015, first in Brazil and then spread across Latin America, the Caribbean, and some Pacific countries. Some we didn't expect are an association with a rare birth defect called microcephaly. Associated with this illness causing a neurologic illness called Guillain-Barré syndrome, discovery that the virus can be sexually transmitted. The routes are basically threefold. First is the natural pattern of infection from one mammal to another mammal host through a mosquito vector. The mosquitoes that carry Zika, mosquitoes that spread dengue fever and a virus called chikungunya, and they're widespread in tropical areas around the world. Also, evidence that that infection can be spread, as I mentioned, by sexual transmission and transplacental from a pregnant woman to her newborn baby. In orange, of the mosquitoes that carry yellow fever and Zika virus. This mosquito species is called Aedes aegypti, and the orange shows the distribution of the species, and the red areas where the orange shows the environment for the mosquito, and the red shows where the mosquito has been found. In the United States, on the left is a map of, in more detail, of where Aedes aegypti is found, a related species called Aedes albopictus on the right. Both related species believed can carry Zika virus, although the primary vector is the mosquito species on the left, aegypti. Aedes and albopictus are different from some of the mosquitoes that we're more familiar with in North America. The mosquitoes that cause West Nile fever, for example. Important to note here on the left that Aedes aegypti, Zika transmitting mosquitoes can bite during the day, but also at night. Some feed on people, but will feed on other animals as well. And to urban settings, they prefer to lay their eggs in made containers, and if those containers are dumped out or dry out completely, the eggs can still hatch when the next rains come. And we use breeding containers like this one shown here to try and capture mosquitoes for study and to better understand them. With only great difficulty, because they breed in in urban areas, very difficult to control. But we use tools like outdoor insecticide spraying or indoor spraying by putting aside in containers, tucked in tree holes that kills the mosquitoes once the eggs hatch. By removing containers and debris where mosquitoes might breed, and in cases by widespread aerial spraying or truck-mounted sprayers. In addition to learning about this new experience with these intense outbreaks of widespread transmission, we've also learned a few things about Zika in the and are learning some other things. The association between the neurologic syndromes, Zika, and the birth defect microcephaly, we're finding that there may be a number of other adverse pregnancy outcomes, more common than we had expected. Pregnant women urgently want to take action to protect themselves against the virus. A lot about where the is spreading, how to make effective guidelines about travel and get tested when you return from traveling. Develop guidelines for pregnant women, babies, and children with possible infections, and couples interested in conceiving. Guidelines to prevent sexual transmission. We have worked with states, international partners to develop a few diagnostic tests and to study how long the Zika virus stays in semen and breast milk. We're also learning what tools to kill the mosquito are most effective and what needs to be done to ensure a safe blood supply in Puerto Rico. About how we identify and diagnose Zika cases. So that most people who get infected will not have any symptoms at all. Those who do have an illness, the 20% that do get ill, almost always have a mild illness that doesn't require medical care. And the Zika are very typical of other virus infections and very difficult to tell apart. They include rash, pain, headache, and red eyes. No specific treatment for Zika virus, and it is thought to confer relatively lifelong protection. Once you had it, you can't get it again. But we're really learning that Zika virus can cause some rare but very concerning complications. One of it is the devastating birth defect called microcephaly, and it is Guillain-Barré syndrome, a rare neurologic problem that can muscle weakness and progress to paralysis. If they're in an intensive care unit setting frequently, and if caught early and treated carefully, it can be reversible, but can also be fatal if it's not caught early. We have a virus on the basis of three elements. Someone has clinical symptoms that are typical of the virus infection. Second, that they have a potential exposure, either having traveled to with ongoing transmission to somebody who has had a Zika infection. For example, a sexual partner of an infected person or a baby born to an infected mother. Element, there has to be laboratory evidence of virus infection. And that's the most difficult because the blood tests that are possible for Zika virus are only available in a limited number of places, usually through CDC or through and local health departments or public health laboratories in countries outside the U.S. Guidance on who should be tested for Zika virus disease and guidance on how to look for illness and for the mosquitoes, both and during the mosquito transmission season we expect here in North America any week now. Guidance on how to prevent transmission and doing two laboratory tests that are being available to state and local health departments as well as laboratories in other affected countries. The second to talk about is who is at risk. Global reports for new places of transmission when it's proven. We our travelers notices on a regular basis, and we've issued recommendations that focus areas with explosive transmission. These are Zika outbreaks right now in 41 countries and territories, Latin America, the Caribbean, and the Pacific. This is changing rapidly, and you can see the latest information at www.cdc.gov/Zika. The important thing we've learned is that the Zika virus outbreak is a public health emergency that poses its significant risks to who are pregnant or who become pregnant. major birth defect like this. We know that they can be infected through a mosquito bite or through sexual contact with an infected male partner anytime during their pregnancy. If they're infected around the time that they conceive, the Zika virus might present a risk to the unborn baby. And if they're infected after they've conceived during pregnancy, the might be transmitted from the mother to the fetus either before or at the time of birth. At any point during pregnancy, and we've limited information about the effects of virus. We do know that there appears to be higher risk of pregnancy loss and other health outcomes, including the devastating birth defect being seen in some South American countries. We know that if a woman has been infected with Zika virus and survived that infection, it's likely to affect any future pregnancies. Infection that she had probably protects her against getting infected a second time. An association between Zika infection and this birth defect called microcephaly, where children are born with that are smaller than average size and with severe malformations that affect the brain and these developmental potential. Rates of microcephaly in the same region with Zika virus occurring in the last year or so. And recently we've identified the Zika virus present in the brain tissue of infants with this malformation. Such as how are babies affected by Zika virus, and which of those will have birth defects. Also meaning that the range of poor outcomes might be much more than just this one devastating condition, that mild deficits may be the result of Zika infection during pregnancy. We've yet to understand fully what they look like. At CDC, urge pregnant women to follow the guidance we've developed concerning risk level to areas where ongoing Zika transmission is occurring at high rates. Those are areas shown in dark purple on the map here, and again, available and constantly updated online. I recommend that pregnant women who are in areas where transmission is occurring use an insect repellent to prevent mosquito bites, wear clothing, and they can to mosquito-proof their home. With that women use the condom to prevent the potential transmission of Zika virus from a male partner who may have been exposed. More to be learned. We are working hard to establish a Zika pregnancy registry, so when women who are pregnant are infected with Zika, we carefully follow them up through delivery to understand the risk and make sure we provide the services to the family. We've established an active surveillance system in Puerto Rico where the infection is currently is starting to peak. And we're collaborating with investigators in both Colombia and Brazil to we can about the link to microcephaly and other pregnancy outcomes. Also studying how long the virus stays in the blood and body fluids, including semen, urine, and breast milk. Be informed, and you can also look for updated clinical guidelines that appear in link on our website. We're sharing up-to-date information as regularly as we can, and there is a line available 24/7 to respond to queries from health officials and government officials, as well as concerned members of the public. So to conclude this here and leave an opportunity to have engaging question and answer period. Very much.
Thank you so much, Dr. Kachur, for that enlightening presentation. Certainly appreciate it. Let's time to go ahead and go to the chat board so we can get some answer some of these questions that have popped up. First question, let's go to Eduardo Silva. The question is, my understanding is that a person cannot get Zika virus by interacting with a person with Zika unless there's sex involved. Am I correct?
The mosquitoes, the virus is only transmitted person to person through mosquitoes, nature, or through sexual contact in, as we've seen in this outbreak. There's a concern that if someone is infected with Zika virus and donates blood, that there is the potential that the virus could be carried in that blood. And so our concern right now for affected countries and territories ensure that that we have a test developed that's appropriate for screening or reducing the risk of Zika in blood transfusions, or we take precautions to defer blood donations from people who may have been exposed.
Second question we have from Elizabeth Doherty. She is asking, we have prospective study abroad students asking if they contract Zika and are not pregnant or trying to become pregnant currently, but if they become infected, what will the long-term effects be in a few years if they become pregnant at that time, say 3 to 4 years after the infection?
People who are infected and have that mild illness or infected before they become pregnant, that illness, before they become pregnant, there is no expectation of a long-term risk. As we said, most people won't have any symptoms, won't know that they're infected. 20% of people will have a mild illness with a fever and a rash, and maybe 1 out of 1,000 of those, or something 1 in 10 out of 1,000 people with that illness might have the severe paralysis associated with Guillain-Barré syndrome. But by and large, most people would have a very mild illness, and we would expect that illness would make them immune to the virus subsequently, so that should they become pregnant a year down the road or 6 months down the road, they would no longer be at risk even if they traveled to a Zika-infected area.
That we're going to go to Laura Lasner. Is there a discussion about required testing of persons traveling to Brazil or assuming other countries where have been present, returning from the country this summer? And then follow-up question is, where can returning travelers go for Zika infection?
The tests that we have are not very good at identifying the majority of people who have that mild infection with no symptoms. Really only valuable during the period of 4 to 5 days when somebody is sick with virus symptoms, and so we don't routinely recommend that people get a blood test after return from travel. Simply, it would be very hard to understand what the results of that blood test mean. The of course is for women who are pregnant, and there you'd want that information to be able to make decisions about how to monitor pregnancy and about the future tests to do. Generally recommending testing for everybody once they return from an infected area. They are available from local health departments across the United States. Generally, you would probably, if you were pregnant, for example, and had an exposure, either travel exposure or an exposure to a male partner who had been ill, you probably still be able to get the test from, the test might be done after your medical doctor's office and sent to CDC or to the state public health lab to be done. You don't have to go directly to a testing center.
The next question comes from Lisa Carney.
Can we scroll up, Carol?
Where can I find information about the rates of Zika virus transmission in the specific region of the country I'm going to?
We've got less information about the specific region in the countries that are affected on our website at www.cdc.gov. Information about risk as it varies by altitude. The virus is transmitted by mosquitoes. We do areas above 1,000 meters are usually free of mosquito-borne transmission from Zika and related viruses. And so you'll see maps that to show for some of the places where there are substantial parts of the country at high elevation. They show where of distribution of transmission in lower altitude areas.
Question that came in from Mike Shealy. Does the U.S. Department of Education intend to perhaps limit federally funded travel to affected areas? My question, we actually tend to follow guidance from the U.S. Department of State whenever there's risk, and that's how we base our decisions. We'll continue the situation and make decisions accordingly, but at this time, nothing. The next question is someone has planned a trip to the Amazon, Rio, and Sao Paulo with 20 students. Their question, should we avoid the Amazon forest?
You might think that you see more mosquitoes in rural areas or in forested areas, and that's maybe in general. The transmitting mosquito or the dengue transmitting mosquito, these Aedes mosquitoes, they are well adapted to living and breeding in urban areas. And so you actually would encounter far more mosquitoes in urban Rio than some of the other destinations on your trip. You want to watch as the time for your departure approaches. You'll want to watch carefully what we're reporting on our travelers' health website, because as in the northern hemisphere enter our mosquito season, countries in the south who already experienced a high level of Zika transmission may start to see transmission falling off in the coming months.
To the next question from Rachel Ward. She's asking, how long is it suspected that the virus can remain in or be transmitted through semen?
Mm-hmm. That's an important question, and we simply don't know. We do, know that, for example, if we look in when people are infected, the virus is present and detectable in blood samples for a period of a week or less. Learning that the virus can be detected in other fluids, including urine, semen, and fluid, and potentially breast milk for long, but we simply don't know how that's going to be. And so you'll see we've been fairly conservative with our recommendations about potential sexual transmission. And as we learn more, I think that we'll adjust those recommendations as time goes on.
Doctor, there are certain types of individuals who are more prone to developing the Guillain-Barré syndrome.
Barré syndrome is not just caused by Zika virus. It's a complication of infections. It's a complication of infections from other viruses as well, including the flu virus and some other conditions that are common in tropical settings. We are trying to learn what we can now about what predispose a person to this syndrome. Right now, we're only just having finished some with folks, with researchers in Brazil, to try and study what occurred there. We had several hundred cases of Guillain-Barré syndrome over the last few months, and trying to compare those patients with others in the hospital at the same time, and see if we can learn anything about risk factors or predictors. But right now we don't know is the simple answer.
Thank you, Dr. Kachur. Now, the next person has some students studying abroad in Central and South America this summer, and she's asking what information and resources should they be sharing with the students before they depart.
Advice to travelers from the CDC, specific if they're going to be traveling to one or more of the countries where there's a risk of Zika transmission ongoing, would be important. There will also be some general information sheets that we're making available on those sites too, for people who are concerned or just contemplating future travel.
Next are males permanent carriers once they contract the virus and is actually transmitted through semen.
Male not permanent carriers, we would expect that they would be able to transmit the virus only that period of time when the infection in their bloodstream, and for as yet unknown period of time after that. But we would expect that once they survive an infection, and once semen has cleared, we would expect that they would be then immune to any future or further infection. Semen, or I think any body fluid, semen, breast milk, there's the potential for infection, and so you should consider that apply broadly than just semen. Then is it feasible that transmission can occur from a mother to it is conceivable, although I don't think we've seen it, that it might also be transmissible from a female partner to a male partner.
We also received a link and some information from Eduardo Silva saying that the government of Punjab is using cell phones to track and control the spread of the dengue very successfully. So we can get that link over to you, Dr. Kachur, for your reference. And the other chat participant is asking if there's a link between Zika and encephalitis.
A lot of encephalitis is caused by mosquito-borne viruses that are closely related to the Zika virus. Many of the encephalitis viruses are transmitted by a different species of mosquitoes, one that tends to be more rural and more of a nighttime biter. But that varies from one to the other, and it's high variable in different parts of the world. But a lot of encephalitis viruses are similar in genetic makeup and in the fact that they're transmitted by mosquitoes.
Great. Next question, Dr. Kachur, says, if the virus is detectable in fluids other than blood, does that mean the amount of time the virus may impact a pregnancy in the future is unknown? Is there a recommended period of time to be aware of the possibility of an infection even after it is no longer detectable by a blood test?
I think what we're most of is if a woman becomes infected while she is pregnant, how long that risk lasts. We initially were expecting that the would only, to the unborn baby would only be important if the brief week-long period of bloodstream infection with a critical period of development in development. But the finding is that exposure at any time during pregnancy may impact on the pregnancy's outcome and on the child that results. And so if a woman becomes infected during pregnancy, I think we're inclined to say that infection at any time during pregnancy may include some. However, for risk for a subsequent pregnancy, a future pregnancy, we expect to be very low, if not zero.
Thank you. Comment/question is, I take students to Haiti every summer. During the chikungunya outbreak over 2 years ago, the only repellent recommended was that which included high levels of DEET. Is the same for Zika?
Is the most effective repellent that's recommended for use against mosquitoes. Should also be, careful to take other mosquito avoidance measures, such as wearing protective clothing, sleep areas that are well screened or conditioned if possible. Flying insect spray or insect spray inside the places where you stay and sleep.
Okay. It looks like Eduardo's put up the link. And the question is, will the CDC push our new travel guidelines for domestic travel if the Zika virus starting actively transmitted in the United States this spring or summer?
Mm-hmm. Carefully, I think that there was very little mosquito-borne transmission in continental United States, where explosive outbreaks in Puerto Rico and the U.S. Virgin Islands now, and some of the U.S. territories in the Pacific are affected in a very important way right now. But the very efficient mosquito vector, while it lives in many parts of the United States, it thrives in numbers only in a limited geographic area. South Florida, we saw a handful of mosquito-borne cases of chikungunya virus when it spread through Latin America and the Caribbean. So we have definitely been surprised by this virus a number of times already. So it's possible that we could see transmission widespread in the United States. But if chikungunya experience holds out, we experience, tens of thousands of travel-related cases, but only a couple dozen mosquito-borne cases of chikungunya a few years ago when it was similarly unfolded across neighboring countries.
I'm not seeing any new questions, so please send any last questions you may have now. Otherwise, we'll be wrapping up shortly.
As a reminder, you can also submit questions on Twitter. Our handle is @GoGlobalEd. Carolyn will go ahead and post that right now. Questions. Once we webinar packaged up and ready to go, we'll be posting the recording on our YouTube channel. You can find that by accessing the Department of Education's YouTube account, and then channels, and you'll be able to Eiffel's channel on YouTube. We've got one final question that we'll take. This is for Dr. Kachur. It says, can the virus be transmitted through saliva?
A case of the virus being transmitted through saliva. However, it can detect the DNA in saliva, and while it not be an important risk of transmission, it might be that where the virus persists, some of these other body fluids longer than it shows up in the bloodstream, it might be that we could use that phenomenon to our advantage in terms of developing a better diagnostic test. And so there's currently research underway to determine whether a saliva-based test for Zika virus would be a breakthrough.
Okay. I want to first of all thank our colleagues at the Department of Health and Human Services. Karolina, thank you for coming to be with us today. Thanks for your collaboration. I want to thank Dr. Kachur for his enlightening presentation, and appreciate all of you guys for spending a little bit of your time this afternoon with us. We'll continue to post information on our Twitter handle. It's @GoGlobalEd, as we've mentioned. We'll continue to relay anything that's relevant. I would also encourage you to monitor the CDC's website and check with the Department of State. As you or your students are going abroad, make sure to register with the Smart Traveler enrollment program, the STEP program on the State Department's website. It takes about 5 minutes, but it's a way to continue to get current and up-to-date information about any country that you're going to. Everybody, I think we'll wrap up for the afternoon. Thanks so much, and hopefully we'll see you soon.
Goodbye.